thank you for tuning in to another episode of the Optimal Health Program. Hope you're all doing well. I have to welcome a whole new audience today to our program, and it's on Rumble, LFA TV, Live from America TV. Thank you for tuning in and watching the program. We'd love to hear from you. We're taking calls. We're going to chat on a variety of different things. And it's nice to see it. And we can actually see how many people are starting to pop up here. Very cool. 902 people are getting ready to look over and have looked at the beginnings of the program. So wonderful. Thank you. For all those of you on Spotify, on YouTube, our TikTokers, our Instagrammers, our Reddit friends, thank you all for listening and calling in as well. We had a record number of calls on the last program yesterday, which is terrific. And by all measurements, I think we're going to break records again today. So this is what I love to do, take questions from people, talk about medical concerns, what may be causing their problems. For many of you know that I'm a physician who's been in practice I'm a physician for 39 years, been in practice for 38 years. And my office is in Garden City. My board certification initially was in family medicine, then became board certified in anti-aging medicine, fellowship certified in stem cell therapy. I have a comprehensive medical nutritional approach where we're looking at all the underlying causes of your symptoms or your illness, looking at vitamins, minerals, hormone levels, absorption, digestion, immune response, allergy, heavy metal exposure through blood and testing urine. So it's super comprehensive. Recently, I saw on Instagram that there are people touting 100-test diagnostic for people. Although you may seem like or think that's a lot, my tests have always been over 200 tests looking at all of these different things, really learning everything we can about your body. So the best way to go forward is to understand everything. I explain it to you, and we set it all in motion. Anti-aging medicine is an important understanding of how to keep your body healthy, strong, and doing better as you go forward, as opposed to losing ground as you get older. And within that, as I mentioned, correct vitamins, minerals, hormones, exercise, eating right. We'll talk about different diet components. And the biggest mechanism to change age-related degeneration is stem cell therapy. And stem cell, the term has been around for about 100 years. Dr. Haeckel in Germany was the first one to call it a stem cell because it could become any other tissue of your body. And if you think of how to answer the aging loss of cells in your organs, your skin, your hair, your heart, lungs, brain, eyes, any part of your body, pancreas. Your own cells are the best way to put new cells into those organs to make them function better and to make your hormones and neurotransmitters again. So a lot of great confirmation and a lot of information I'm going to be talking about as well. If you'd like to call in to ask a question, 1-888-420-9272 is the phone number. 888-420-9272. And of course, we'll take your text messages, emails. We have a bunch from my website. People are heavily hitting the website with questions, and I love it. It's great. It's what I meant to do. I was on the radio on a variety of different stations, including WOR, WABC, for the better part of 35 years, and was always looking for something better than radio, regular radio, to be able to connect with people. And certainly this kind of fell into my lap. Frank, the producer, is awesome. Sabrina, his wife, is awesome. And now we're having a great deal of fun, a lot of fun. And we'll be putting together lots of great information for you. So let's talk about a couple of things. Some of the latest research. Soy milk is better than cow's milk for cardiovascular health. And for some people, this may be hard to understand, but soy milk typically has less sugar in it, so there's an advantage there. There are people that will be allergic to milk, and there are people that will be allergic to soy. But either way, when you're allergic to one, use the other. Soy milk also has lecithin in it that helps to lower cholesterol, triglycerides. So there may be many benefits because it's a plant component and not an animal product. So when you have cow's milk and you have a lot of sugar in cow's milk, that may be detrimental to your body, the lining of your blood vessels and such. So important to take a look at that. There are a lot of studies that have been done on this. This is a meta-analysis. Also, the soy are associated with lower risk of breast and prostate cancer. So important to think of. For all of my patients and people who listen to the program, I tell them to get on Google Scholar, And in the search box, plug in all sorts of interesting topics, and you'll be able to learn about the benefit of nutrients, of foods, and look at statistics. Because statistics show us that there are many disorders on the rise now and have been for a long time. As a side comment, I think the traditional medical approach has been missing the point, not correcting nutrients or diet. They don't believe in vitamins. For the most part, it's look at your symptoms and problems and put some medications on board and see what happens. I'd rather maximize your health and make your body stronger going forward to change these things as opposed to relying just on meds. For case in point, we have patients that are diabetic and their blood sugar is high, of course. Their pancreas is tired of making insulin. Their insulin levels are lower. Their C-peptide levels are lower. That's a measurement of insulin production. So right off the bat, I tell patients during consultation, after I examine them, do their blood work, cut your carbs down to 30 grams or below per day. Do exercise every day. Walk for 45 minutes a day around the block. Go to the park, laps around the school track, get on the exercise bike, outdoor bike, elliptical, go to the gym, Pilates, yoga, do whatever you can because that will help your muscles to burn sugar and fat. We test your hormones. If your thyroid levels are low, we correct that. That'll help to burn sugar and fat. And same with testosterone, IGF-1, DHEA. So there are multiple things that we can do to correct the picture at the base cause. For those individuals as well, we'll do stem cell therapy because your own cells from your body, as we put them into an IV, will go to areas of damage and degeneration, set up shop, and become brand new cells of that damaged organ. If it's your pancreas, and we've seen this over the course of 2 to 4 or 5 months, people become non-diabetic. So very important to understand your body and fix things more naturally, as opposed to necessarily relying on drug, shots, insulin, etc., to try to change the picture where you'll still be diabetic and you will still have the progression of the nerve and the vascular and organ damage. So, again, lots of stuff to talk about. And if my voice holds out, which I hope it will because I talk all day, every day with patients, we'll answer tons of questions. Another interesting but super scary study. In a meta-analysis over 2,000 women that are postmenopausal, nearly 40% of postmenopausal breast cancer cases are linked to obesity. Now, for some people, they may not understand that, but the reality is, and we'll get to that in a second, the hormone receptor positive breast cancer cases are attributed to excess fat percentage. So fat cells hold on to different things that we don't want in the body, and certainly chemicals, heavy metals, some of the compounds that are damaging to your hormones and damaging to your breast tissue. So when we talk about excess fat on board, what precedes that is typically excess sugar, because sugar, as you have that on board, tends to make you gain weight. It's harder to burn fat when there's excess sugar on board. That's why every diet now is a low-carb diet, cutting back on sugar and allowing the body to burn fat as a primary fuel. So low-carb diet, exercise, etc., correct hormones, you burn fat. So the sugars that are there in large amounts to allow a person to gain the weight feed cancer. If we look back to work done in the 1930s where Dr. Otto Warburg won the Nobel Prize, he had proved that glucose or sugar is a primary fuel for cancer because sugar is used to make energy for all cells of your body. It's no different for cancer cells. They've just mutated and they're growing faster. They're able to suck up more sugar and create more food for the cancer and more damage. So terrific, terrific research. And this is something that I've been talking about for a very long time. Also, when that sugar fuels the cancer and tends to make it grow, the metabolism of the cancer cell makes lactic acid. The lactic acid, if it's pushed outside of the cancer cell into an alkaline environment, it'll stimulate vascular endothelial growth factor to grow more blood vessels to the cancer to feed it more sugar. And I remember learning about this probably 20 some odd years ago in a Cancer Treatment Centers of America conference in Tulsa, Oklahoma, where I had the unbelievable honor to meet and actually sit with Linus Pauling, one of the greatest minds in history of the world. He had 2 unshared Nobel Prizes. Super, super genius. But there's another story about that a little bit later. But that's why I think that cancers are on the rise. The postmenopausal breast cancer, nearly 40%, too much sugar, weight gain, and that's what's being shown in these studies. Once again, 888-420-9272. If you'd like to call in to ask a question, you can do so now. 888-420-9272.
We got some questions coming in on Reddit. We got a few.
Okay, Reddit's our buddy. We have a lot of Reddit calls yesterday.
We do, and also shout out to the LFA TV chat. If you have any questions within the live chat, we will also answer those as well.
Excellent.
Unless you'd like to call the number below. But I had a wrist injury where I ended up with a small ligament tear and a dislocated ECU tendon. Over time, it has developed into more pain up into my forearm and now tennis elbow. Can stem cell help me? I've exhausted all other options over the past 3 years.
Yeah, typically any tear in ligament, tendon, connective tissue, cartilage, muscle, virtual organ, any wear and tear, stem cells' job is to go where the damage is to create and become brand new cells of that damaged tissue. As I was mentioning before about the diabetic and brand new pancreas cells making more insulin, if we find a joint has damage, and we love to do MRIs because that's the best picture of the joint, all the ligaments, tendons, cartilage, everything, nerves, connective tissue, we would then pinpoint and inject the stem right where the damage is so that it sits at that spot and will constantly create brand new cells of that damaged tissue. So that by far would be the best way to repair ligament, tendon, cartilage damage. And we've done it for wrists and elbows and shoulders, hips, knees, ankles, low back, virtually everywhere in the musculoskeletal realm. We've done it for torn muscles in the quadriceps and hamstrings. So it's a terrific mechanism for the musculoskeletal arena, as it is for any of your internal organs and, certainly help with neurologic disorders. So that would be the best mechanism for your damage in your joint.
And then we have our first question from Rumble, the Rumblers.
Awesome.
What about yearly mammograms? I don't comply and get slit of grief from friends. I've had 1Q decade.
So mammogram, as you know, and most people know, is an X-ray, radiation of breast tissue once they compress the breast and create pain for you, which nobody really likes. There is an alternative test, which I think is better because research has documented it's better. You could look this up online, called thermography, Thermography. Thermography is taking a heat picture of breast tissue, and it's an infrared camera that takes a heat picture. And when they compared mammography and thermography side by side over the course of 10 to 12 years, and that study may still be going on, they found that thermography picked up abnormalities way before mammography did. So for many years, I've been recommending thermography. And interesting question, because of what I mentioned a moment ago, cancer cells need blood flow. And in that blood flow, glucose and sugar is what makes cells grow faster. Cancer cells are different than regular cells because they're growing super fast. So they need more glucose. So when a cancer cell in the breast, for example, starts to grow, it's going to create a difference in the heat picture in that tissue because it's got more blood flow there. So if the rest of the breast tissue doesn't have any other blood flow growth and the rest of the breast tissue is a certain temperature, which is picked up on this device, and one area, front view or side view, is showing heat, then that's a suspicious spot. So that's the area that should be looked at a lot closer. MRI should be done. And then, of course, the option of maybe doing biopsy. But there's no side effect to a heat picture. Nothing touches your body. There's no downside, no risk, no side effect. Another curious comment I have to make on mammography is that there are some women who have a genetic risk of breast cancer because of the BRCA gene, BRCA gene, and if the family members have the BRCA gene, a while ago they were doing mammograms twice a year on these young women. And then the thought was, wow, we better stop that because we think we're seeing changes in breast tissue that might, be a forewarning of, cancer. So they stopped doing the twice-a-year mammographies because they thought it would be more of a risk than it was a benefit. But I think thermography is by far a better test, by far.
All right, we got a YouTuber.
Okay.
All right, let me get this out. What are these peptides good for? GHK CU, CCK8, CCK58, GLP1, GLP2, and thymazine alpha 1, and can you take them every day?
So the easy way to answer that question, the GLPs, as everybody knows, are things that decrease your appetite, help to burn sugar and fat. So these weekly injectables are used to help to bring down weight, and they're used for patients that are diabetic. So there is benefit to that. I don't recommend people be on these things forever. They're usually weekly injections, and it gives you a little bit of an edge, and you kick in your low-carb diet, your exercise, correcting vitamins, minerals, and hormones, then you get a better result that's long-lasting, and those meds can be used short-term. The thymosin alpha and beta are also good for immune response. They're good to decrease the inflammatory cascade. So I think they have their place. And as well with the GHKs, in a similar fashion, decreasing inflammatory mechanism, helping to heal. But it's not like you're going to take these things and say, oh my God, my world has changed overnight. In a separate conversation, I talked to people about NAD, which is probably the most popular and common and most important peptide. Also sermorelin, which helps to convert to IGF-1. These two are things that your body's always had and you'll always need. Your body's had NAD since you were created, at conception, and NAD is required in just about every biochemical pathway in your body and will be the agent that takes oxygen and bring it down pathway step to step to create 36 molecules of ATP. Individuals that take the sub-Q NAD injection, they'll say, wow, I can't believe my focus, concentration, word retrieval, memory is so much better. My mood is good. I want to get up and go. And if you speak to lots of people, and almost everybody is going to have that loss of drive, endurance, ability, strength. They feel tired, achy, their mood is not good. But so you could benefit from something your body's always had that you're not making enough of anymore. So if we start to put that back on board, you see great result. But that's something your body has always required. The others, there's no real requirement for them, but they can help. These things don't work on 100% of people, but if they try them, you may get some benefit with it. The question always is, for me, what are you trying to see or change or do? So if you have inflammation in your gut and you take the thymosin or the GHK or the BPC 157, you may see no result if the inflammation in your gut is coming from food allergy. You have to take the food out, then the inflammation goes away. So we don't want to use the peptides or try to use them as we might use an aspirin or an anti-inflammatory or an allergy pill. It's just kind of covering up the symptom and not changing the cause. The other important mechanism is IGF-1. So your body, when you're born, creates IGF-1, growth hormone, converts to IGF-1 so you can develop your height. People that are very tall have a lot of it, and basketball players have a ton of it, so they grew a lot while their bones were still open, but when your bones close, you can't grow anymore. People that are shorter don't have as much, or maybe not enough. As you put together an understanding of what IGF-1 does, it's interesting to see as you get older and your body's not making it, and we can check your blood levels for IGF-1. You don't sleep as well, your hair, skin, nails change, memory, focus, energy, mood, concentration, all sorts of things change. You're not getting the results from exercise. You go to the gym, you're doing this or that, and you don't feel that great effect in your muscles, and you're not gaining the result like losing the weight. So once you put that on board, and we can track that and bring that up to a range of about 300 on your blood test, you see those things. And we've done this with thousands and thousands and thousands of people. So we know what will happen because your body's always needed that. So the two most important are the NAD and the IGF-1. So that's what we start with. We can pepper a little bit of the others here and there, but again, you may not see that much from the others because they're not things that you have in your body from conception that you require to create your body's metabolic, result.
All right. We have from Reddit, does stem cell therapy help fibromyalgia?
So fibromyalgia is a term that's given when people have multiple aches and pains all over the place. And that could be from slight cumulative effect of wear and tear on ligaments, tendons, cartilage, connective tissue. Some people might have fibromyalgia type pains, but may have Lyme disease. So when I see a person with fibro, we have to run the gamut of testing to see what the underlying causes are. And everything that I ever do with patients, it's the same conversation. We have to find the underlying causes. If you miss something that's an important cause, then you're not going to see a change. But that's why we do this. So if it's Lyme disease, we have a protocol treating Lyme, antibiotics, vitamin IVs, etc., nutrients. If the fibromyalgia is caused by wear and tear, then the stem cells become a major component of repairing ligament, tendon, cartilage, connective tissue. If a person's got fibro and we do a series of blood tests and the blood test comes up that you have rheumatoid, stem cell helps to shut down the inflammatory cascade of lupus and rheumatoid. So it depends upon what your fibromyalgia is outlined by. If you have 100 people with fibro, you may have 10 or 20 different reasons why they might have it. So I want to find that information out and then put together the best component to be able to create that repair. Some people have heavy metal exposure, and that may be damaging nerves. Then the nerves are not allowing your muscles and parts of your body to work correctly. So it could be a variety of things.
We have another one on Reddit, basically a big explanation of some spinal fusion that he had went through in 2022. But the basic question would be, can stem cells be used on lumbar disc regeneration?
So we can't take a big, long needle and go from your back and bypass around your muscles and get on the side of your vertebrae and try to avoid your big nerve roots and your cord, of course, and inject into your disc. There may be researchers in Germany or Italy or France doing some of that, but it would have to be done under fluoroscopy, an active X-ray to see exactly where the needle's going. I don't know of anything that puffs up the disc like we would like to do that. We have done injections into ligaments holding everything in the vertebrae together with stem cells, and people have some significant stability and benefit from that. But it depends upon how much wear and tear you have. Is there one disc area? Is it completely herniated? Are there 2 or 3 different areas? So, the question has to be answered. If you've had surgery and there's a fusion there, that disc is gone, and so that's not really causing you much of a problem. But you still might have pains and issues around that area because taking the disc out didn't really help the ligaments, tendons, connective tissue, muscles that attach tendons to bone to be able to help and move that area. So we'd like to get a good understanding as to exactly what your body is feeling and going through. Physical exam would tell me a lot, so I could obviously do that. We might recommend doing a nerve conduction study so we can see if there's any dysfunction at the nerve at that area of your back and going down to your legs. So again, we'd want to gather as much information as possible. But the idea of using STEM to repair tissues throughout your body is a genius idea, and we've done it for many, many things. There's just no mechanism yet to be able to put that needle into the disc and pump it up, like a tire that's losing air.
So we got a YouTuber asking, hey, Doc, I've been getting random episodes of brain fog. Like, I just can't think clearly for a little while. It's not dizziness, but it's frustrating. Could that be a diet related, or should I be worried?
Great question. And I talk about brain fog every day. Not that I don't like talking about brain fog every day, but it just goes to show that out of patients I see every day for the past however many years, 38 years, more and more people now have brain fog than ever before. So it's a real thing. A lot of doctors, brain fog, you're stressed, you're this, you're that. They don't want to dig into it. I love to dig into it. That's my, my reason to live. My existence is based upon finding out things that other doctors don't. Yeah, it kind of makes me look good, makes them look bad. So the point is that brain fog could come from a vitamin deficiency. It could be B vitamins. It could be vitamin D. It could be any number of things. It could be hormone decline or deficiency. It could be heavy metal exposure because metals interfere with how your minerals get to the receptors on your cells, including your brain, to allow your cells to work appropriately. Allergy can cause brain fog. Inflammation in the sinuses can cause people to be foggy and a little bit out of it. So there are many things that can do it. But within one blood test, we look at all of that, and we're able to pick up exactly why that's occurring. In the younger population, the reasons are more likely allergy-related, nutrient deficiency, gut issues. There are people that have irritable bowel and celiac, which we're going to talk about in a little while, that have brain fog because the gut's not working right. The doorway to get every nutrient and all your good food components absorbed is just not working right. You're not getting the good things in, so you're suffering and your cells are not getting fed. Vitamins are food for your cells, of course, and including your brain. I mean, what part of your body is as active as your brain trying to control everything and connect everything? So there are many things that can cause brain fog. And once we see that big blood test with 200 different components, 20 some odd page test, we can tell you it's a little bit of this, it's a little bit of that. Let's give you a B12 shot today and tell me how you feel from the B12. If you don't convert B12, which is a real thing, probably 70% of patients I see don't have a gene that would make an enzyme to take regular B12, methylcobalamin or hydroxycobalamin, and make it into methyl B12, which is the only one that works in your cells. So if the gene's not there, you could have all the B12 in your blood you want. It's not going to work. And the fun thing is, if we see that and we give people a B12 shot in their glute or their arm, and even within having them sit in the office and wait a little bit, they'll start to say, yeah, you know what, my brain functions better. My focus and concentration is better. If we talk about using an AD, of course, your brain becomes super. So it really depends upon what your specifics are. And then that's easy to correct. There's not 1,000 things that cause brain fog. There's a small handful.
Very good. And we got the Rumblers. Donna is asking, Dr. Calapai, are you familiar with Cushing's disease/syndrome?
Yes.
That was the question. So I'm assuming there will be some follow-ups on that.
So yeah, Cushing's is a dysfunction, a steroid dysfunction. Typically, people will have excess body fat. They can have a hump on their back because the fat pad develops behind the neck. But just like anybody else, if you look at their vitamins, minerals, hormones, and you're looking to maximize their ability to absorb nutrients and fine-tune their picture, you can see some pretty significant benefits. Sometimes there are medications that are used for it, but I'm not the doctor who says, oh, yeah, here's a disease, there's the category, here are the drugs. I'm always trying to fine-tune and fix other things. And similar to other autoimmune mechanisms, we don't say, yeah, you've got an autoimmune disease, here are the drugs. We want to look at heavy metals because heavy metals play a role in autoimmune disease. So you really have to look at the entire picture. And it would be easier for me to give you an idea as to what you can or can't do or what you might expect, looking at your blood work and understanding your entire picture. So it's not as though, as I see it, here's the name of the disease and this is what you're relegated to. We want to understand everything else that's going on in your body and see how we can help to improve and, change that condition.
Okay, we got Instagram. Last year I fell down doing parkour. Parkour. All right, I haven't seen that one in a while, but
yeah, a little dangerous, but
little
cool
bit.
To watch.
Yeah, exactly. My hands are sweating. I landed on my tailbone against the concrete floor. X-rays show no fracture, but it shifted very much to the right side of my hips and not at the center. I visited multiple specialists, including physio and Chinese physicians, but they are unable to fix it. I'm currently having knife-sharp pains around my pelvic area and was wondering if stem cells could be helpful.
So the injury that's created, and this can happen in any joint, any part of your body that hits the ground, knee, hip, shoulders, anywhere. Your coccyx is this little bone sticking down off the bottom of your sacrum. And if you hit that, it's going to cause significant pain. You may be damaging the skin between the bone and the ground that you hit. You could be damaging nerves there. And sometimes that inflammation will take a very long time to go away. But similarly to a person that falls and hits their elbow or their knee or anywhere, the idea of using your own cells to shut down inflammation and to grow and repair the damage is ideal. It's genius. So being able to put those cells in to create that growth and repair to get your function back to normal would be ideal. An X-ray is a good test because it shows you the outline of that bone. But an X-ray is not great for your knee, your ankle, your hip, your shoulder because there's a lot more tissue involved. This is a very small, relatively limited area. We've done PRP into the coccyx for mild issues, and we've done STEM. So I think STEM is the greatest mechanism of healing. So, yeah, that would be ideal. I don't think physical therapy or there's not a medication that's going to change the mechanism because you have a little bit of a, crush injury. So important to create a healing mechanism right where the damage occurred. But that's one of those things that untreated could be a problem for a very long time. Parkour coccyx, parkour butt. I've seen people that have fallen from a variety of different places, and I feel bad. I mean, I love watching it. It's really cool. Like in that James Bond movie, the guy was jumping out the windows and sliding down here and there. I'm like, how does that guy figure out how to do that without killing himself? But there are people that are very talented at that. Not me.
Not me. But just a heads up. So Donna, the one that asked about Cushing's disease, said, thank you, would love to follow up with you. So I'm just giving the Rumble chat a link to your website.
Yeah, that'd be great. That's, again, I'm all about giving out information to people, having this connection, chatting. Certainly we'd love to see you in the office. 516-794-0404 is the phone number. Website, drcalapai.com. Thank you for all the emails to the website. I'm working diligently to answer as many of them as we can. So we have 3 staff, my PA Mindy, Donna, myself. We're going to be adding another PA relatively soon for a couple of projects. So, yeah, we're gearing up as best we can.
We love it. And we have another question from Reddit. I feel severely disconnected from everything. Surroundings, nature, music, people, as well as from myself, emotions, body sensations. It all started when my body went into a shutdown because I was scared getting into another psychosis. It was like a protecting mechanism that made me disassociate from everything. I also feel mentally and spiritually disconnected from the source. Do you think stem cell therapy could help me? Interesting one.
So sorry to hear about the different things that you're going through, but I'd like to find some sort of underlying mechanism to see why your body is going through that. I mean, typically people that have problems handling stress have very low adrenal hormone. DHEA, adrenal hormone, is meant for stress response and kind of keeping you together when you go through that. We also see low IGF-1 would correlate with that. Heavy metal exposure on the brain will do that. And we know people that have heavy metal exposure not only can have MS, Parkinson's, Alzheimer's, and other related issues, but just damage in the ability to make your neurotransmitters. There is a really cool test that I keep forgetting to talk about, but we did a little chat on it the other day, last week, called a brain scan. It's a device where you put a funny-looking cap on your head. Of course, it's got to be a funny-looking cap. And we put a little gel into each of like 20 different openings in the cap, and you put these little little round metal devices that are attached to wires that go to a computer, and doesn't hurt. You just look funny. And you get on the computer and you do some of the tests. You answer questions. It looks at speed of your brain waves and it really looks at how your brain's working. It's a really unique test. There's no other test like this. Most of these things are used in research facilities, but the company that, we're working with this has allowed us to do this. So I would like to see what your brain waves look like. And if we start to correct deficiencies of vitamins, minerals, hormones, I want to see how well your body does. Also, you can't have a dissociative mechanism without having changes in your neurotransmitters, because your neurotransmitters control the speed of your brain, your thought, all of this. So there may be some issue with your neurotransmitters, which I think would be significantly improved by doing stem cell. So take the case of a person that's had a stroke and, you have a big fat brain, it's all fatty tissue. And if in the middle somewhere a stroke occurs and you can't move your arm or your leg or your face droops, the cells that are responsible for those areas are damaged and are dying. And the neurotransmitters they're supposed to make to keep that electrical flow super fast and perfect are just not there. They're not doing it. When we do stem intravenously and then we drip the stem cells into the nostril when you're laying down on your back and, one syringe at a time with a little rubber cone on the end, it drips into the back of your nasal cavity, gets into your brain, then it goes to where you have damage or degeneration. That's what stem cells do. They go where the damage is, set up shop, and they make brand new cells and therefore more neurotransmitters. So I always think stem cell is a wonderful repair mechanism. There's no mechanism better than stem for that. And I would expect that you'd get benefit to those areas, and we'd like to figure out exactly where by doing that brain scan test. And I think it would make sense to do that. But I want to gather more information, from you right off the bat. I'm curious to see if you had a SPECT scan or other scans that can be done of the brain to look to see if there's anything else going on.
I'll await a response on that one. We have another one from Reddit. Doc, I've noticed my metabolism seems slower as I get older. I used to be able to eat anything, but now I gain weight more easily. Is there anything I can do to speed up my metabolism, or is this just
curious as to how old you are? Because everybody that's ever lived or walked on the earth or otherwise goes through that. And the reasons why all of us will go through that would be a decline in hormones, thyroid, DHEA, testosterone, because they control fat burning. If you look at people eating carbohydrate, the more carb you eat, the harder it is to reach the fat to burn it as a primary fuel. Some people that eat carb and fat, it's a double whammy because the carb decreases the ability to burn the fat and you're adding fat on top of that. So usually we walk through a variety of different dietary
35, by the way.
Ideas. Well, it'll change fast once we put everything together for you because at 35, you're still in relatively good shape and it's very reachable to be able to do this. But the mechanism is, your metabolism is controlled by your hormones, by your diet, by your exercise. Are there some people that have this issue because their job exposes them to heavy metals and heavy metals damage your hormones? Yeah. So that's a weird add-on, but I've seen it because we look for it. The reason I see so many weird things is because we look for weird things. So at 35, if we cut your carbs down, we correct your hormones, you get your vitamins in perfect range, you're doing a good amount of exercise, your body will fall right back in line, and you can get back to where you were, 10 or 15 years prior. We see it all the time. So it's an easy mechanism to fix. And the big blood test we do, by the way, for people that come in, everybody wants the blood test. Even before I say, hello, how are you? People say, I want the blood test. So nice to see you. But, usually it's a little greeting first. But we send the blood out to a lab that participates with all the insurances, so there's no cost for the blood work for just about all the people that we see. But, it's a very easy mechanism to change. And I tell people, and we've had patients that they want to do the diet, they're not really doing it. And then I find out they're not doing the diet, and that's holding back their fat burning ability. And they're not really doing the exercise. And I can tell they're not doing the exercise. And, they say, well, I'm not eating this or not eating that, and I'm doing the exercise and it's not working. You can tell. A person who comes in, it's almost 300 pounds. If they say they're on a low-carb diet, probably not. They say they're exercising every day, probably not. And we still obviously want to create this result with low-carb exercise, hormone, vitamin correction, and then things will just take off. It works on everybody.
We have a Redditor business professor they go by. Hi, Frankie. I have a question on hypothyroidism.
Cool.
I quit thyroid meds 18 months ago due to extreme side effects. Tried Dr. Ardis Thyroid Complete to no avail. TSH still at 14. Help.
So, although we like to think in a linear fashion, where having a thyroid problem, taking a supplement or even taking thyroid meds, etc., is going to change the mechanism, there may be something more significant behind the picture that is not allowing you to get your result. So I've seen lots of people that have thyroid abnormalities, may have thyroid antibodies because of heavy metal exposure. And in some cases, people that have silver fillings in the teeth, the amalgams, which are 50% mercury, by the way, may be damaging their thyroid with that mercury. It's inches away. Doesn't have to travel far. So the mercury in your filling gets into the blood vessels in your teeth and gets to your thyroid. So sometimes you have to address that and start to change and improve the picture. So with some people, as we start to correct that, others we may recommend correcting a low IGF-1 or low testosterone. The IGF-1 might be able to help the thyroid work a little better. For some people, they need some iodine because that's integral in the creation and the sustaining your thyroid function. So there are a lot of different things around that. Now, the other comment, which I see all the time. If your doctor gave you thyroid medication, he gave you Synthroid or levothyroxine, that's only T4. So if you're only taking T4 and your T3 is low, and many times they don't test that because they like to test T4 and TSH, taking T4 is not going to change your picture that much because T4 doesn't really convert to T3 in most people that I see. So if I do a 12-part thyroid panel, T3, T4, TSH, free T3, free T4, reverse T3, T3, T4 uptake, and the thyroid antibodies. I'm being very mechanical with my hands today.
We're Italian.
Because I'm Italian. You might see the real picture and see that you need T3 and T4. I've seen that. If I've seen it once, I've seen it 5,000 times, maybe more, over the course of all these years. So there are reasons why you're not getting the result you want, but it may be from heavy metal exposure or you're just not getting the full thyroid panel done. So, yeah, that's what we do. We'd love to help you out. Give us a call at the office, 516-794-0404. Anybody can. We'd love to help you.
We got the Rumbler. Donna says, breath of fresh air listening to Dr. Calapai.
Oh,
wow.
What if,
that's
my mother and she's calling under an assumed name? I wouldn't put anything past her. Thank you so much, Donna. You're very kind.
That was a good one. Okay.
Very kind. Thank you.
We have a few questions in the wings here. Would stem cell help degenerative this is a hard one for me. I didn't go to medical school. Degenerative
anterolisthesis?
Thank you, sir.
Yes. No one will ever beat me at Scrabble. If I get enough letters. It's just you can't because I have all these medical words. It depends upon the extent of the damage and where it is. We've injected stem into ligaments around the vertebrae, just like you can see with my handy-dandy spine here. So ligaments are all over the place, holding everything in position. So anterolisthesis is a forward shift from one vertebrae to the next. So besides doing some physical therapy,
I have some more info on it.
Weight training, yeah.
So my dad had back pain for a while and rather rapidly lost all strength in his calves within a few years and is starting to lose strength in his quads. He is seeing a surgeon who started with an MRI. Below is the impression. He will be seeing his surgeon to go over the results and possibly treatment soon. But I wanted to ask if stem cells is any possibility.
Well, I'd have to see the MRI because that's the focal
so here we go.
point.
His MRI stated, degenerative grade 1 anterolisthesis.
Anterolisthesis, yeah.
Thank you, sir. L4 on L5 with superimposed disc degeneration and moderate to advanced facet anthropathy resulting in advanced canal stenosis and moderate to advanced bilateral foraminal stenosis.
Okay, so
I should send some of these just to you.
To make a picture or to try to make it easy to understand, your spinal cord goes from your brain all the way down your spine, and it's inside the vertebrae. Now, that canal that the spinal cord sits in, and your spinal cord might be thick like your thumb, is a long opening between your vertebrae, and there are ligaments and tendons all around that. If that canal starts to become narrowed by arthritic change or damage to the vertebrae, the cord itself will have pressure on it. That's called spinal canal stenosis. That's down the inside of the spine. When you talk about foraminal stenosis, the foramen, that's where these nerve roots, these little yellow things, come out between the vertebrae. So there's a little bit of a space on the lower part of the top vertebrae, shaped like a C, and there's a little space on the upper part of the bottom vertebrae that allow for the nerve root to come out, hang out, and do its own thing. If that foramen is narrowed, that's foraminal stenosis. So foraminal stenosis or central stenosis is worsened by the loss of the disc height because you're pushing now the vertebrae closer together, and that narrows the openings. If he's lost the strength, that means there's a significant amount of pressure on the nerve roots and maybe the cord. If foraminal stenosis is the only thing there, sometimes a surgeon can cut away some of the bone to give that nerve root more room to exist. The canal stenosis, however, they may have to go in and open up that area where your spinal cord sits. So those are surgical interventions. There's no injection we can get inside that area. It's really overgrowth of bone narrowing down the central canal, and sometimes osteophytes or bone overgrowth creating the foraminal stenosis. So it can occur in different ways. But yeah, that's what the MRI sounds like.
We have Reddit. I feel like I'm always tired. Oh, we have a caller. We'll go to them first.
Okay.
How about that? All right. Good to go.
Okie dokie. Who do we have online?
You are live.
This is Kelly.
Hey, Kelly. How are you?
Cool. I'm in a lot of pain.
Okay. So what sort of problem are you having?
I injured my back in the Navy, and it's just getting worse over time. And right now, the pain's on the right. I can't bend over and straighten up.
Of your low back?
Yeah.
Okay.
My toes and my fingers go numb, especially in the cold.
Well, that's coming
and
from
they're
your neck
white.
to some extent. So if you have low back issue, that would affect your legs, and a neck issue, if it's a disc, etc., might affect your shoulder and your arms. Although there are people that have Raynaud's phenomenon that can get cold fingers and they blanch and turn white or purple depending upon temperature. But we need to see MRIs of both those areas to see what your discs look like.
I've had MRIs done by the VA, and I've got like 5 bulging discs, one with a hairline crack or whatever they call it.
That's in your low back or your neck? The 5.
It's from my neck down to my lower back.
So you have some disc issues in your neck, some in your low back.
And in the middle.
Okay, gotcha.
And in the middle of my back.
You do a lot of physical stuff, or did you fall, have any injury?
I hurt my back in the service, picking a lathe up to put on picking a chuck up to put on a lathe. And that was back in like 89. And
so,
it's just gotten worse.
Okay. So, I would need to kind of look at your MRIs, examine you, palpate, press upon the areas from your neck down your back and see where you have the dysfunction. For some people, we've done PRP into the muscles around the back, and that's relieved some of their pain. And some people, we've done stem cell. So it depends upon what physical exam in the MRI would show. The prior caller that had central canal stenosis, that's a whole different mechanism. But I'd like to be able to see what your MRI and what your physical exam would show.
Okay. How do I get that to you? I got.
Yeah, just give a call to the office at 516-794-0404. That's 516-794-0404, and they'll set you up.
All right. Say that again, please. Okay, so I didn't have a pen and paper ready.
Oh, yep. No problem. Are you in the Rumble? Where did you find the program?
I'm in Rumble.
Rumble, love it. Okay, I'll put it in the Rumble chat for you, but it is 516 794-0404. I'm putting it in the chat right now.
Okay, great.
Perfect.
Thank you.
Love to help you out. Wow, the Rumble chat is going crazy.
We love it.
It'd be great.
Thank you so much.
Bye.
Wow, look at all this.
Bye.
Bye-bye.
Bye-bye now. We, again, love to help you. Thank you. Wow, this is so cool. I keep making the analogy to radio and being on the radio for that many years, 35 years, and et cetera, not being able to connect or talk or text or email with patients was kind of rough. But now, looking at all the calls We had over 900 people that were standing by. Now 190 people on and listening. This is wonderful. Thank you so much, people. These are my peeps.
Peeps.
Right?
We
sort
love
of.
it. We're on Rumble. It's where you belong, Dr. Chris.
That's right. Okay. 888-420-9272. If you'd like to call in to ask a question, you can do so now. Let's get some more calls. I'm here for your calls. We haven't heard from TikTokers. We had a couple of YouTubers, a couple of grammars. Come on, we've got to pull it up. It's got to be a competition. See who has more calls.
Okay, got one from Reddit.
Okay.
I feel like I'm always tired no matter how much I sleep. I get a full night's rest, but I still wake up groggy. Is this a vitamin deficiency? What is going on?
Sometimes it's deficiency of vitamins like B vitamins or vitamin C. To some extent, maybe vitamin D. But it could be a decline in thyroid, could be a decline in other hormones for women, estrogen, progesterone, testosterone also for women, testosterone for men. Could be virus, because we've seen people that have aches and pains. Sometimes they have flu-like symptoms, other times they don't. And it correlates with Epstein-Barr virus, cytomegalovirus. So there are probably 50 different causes of fatigue. So that's why the super-duper big, awesome blood test will give us all that information. And then we put together that correction. Like I said before, a few minutes ago, for people that have thyroid issues, if a doctor's only testing T4 and TSH, which is the status quo, you're not going to see low T3. You're not going to see thyroid antibodies or autoimmune disorder. So, as I say, when I test the full thyroid panel, we pick up more things because I always test the T3 on the first visit. Always test the thyroid antibodies as we take a person's history and look at all of the underlying, causes. So, very important to have the right blood test done, because if you don't, you're going to miss a lot. Some people are also very tired because they have a lot of carb in their diet. And look, the average person doesn't say, wow, I have a lot of carb. Some people have eggs for breakfast, but they have toast. Some people have cereal for breakfast, which is bad, unless, of course, it's grain-free cereal. Some people have carb with every meal, and they'll have some fruit for breakfast and the sugar from apples and oranges and bananas, and they'll make a smoothie and put peanut butter and banana, and they're just overdoing it. But they'll also have some sort of carb and rice for lunch and for dinner. It's just carb 3 meals a day is way too much. So when your blood sugar goes up, your body dumps insulin, your blood sugar crashes, and you're tired and you're miserable. So that can keep happening if there's too much carb in your diet.
Boom. And then we have from Instagram, I think I have high cortisol. I haven't changed my diet. My physical activity hasn't changed much, but I feel like my body is constantly bloated. My face is especially puffy. Could this be high cortisol / how can you treat cortisol levels?
Well, it's not as much about treating a cortisol level as finding out, why this is occurring. So cortisol fluctuates. It's not as much of a culprit as the majority of things that we see that happen all the time. So if a person's tired, if they feel like they're puffy, depending upon what they're eating, it may be more diet related. And as you fine tune the diet and now your body regulates itself, you start to see that you're doing so much better. It would be good for you to give me a little bit more information on how you're feeling. Did she mention that she was feeling bloated?
Yes, constantly bloated.
So the number one cause of bloating is diet, and either A, carbohydrates in the diet, too much sugars. Out of all the foods, people tell me every day, grains cause bloating. There are more GMO now than they ever were before, and there are more chemicals in the grains now than before. And I have a ton of people, when they go to Europe or South America, they have grains that are just pure, they have no problem. But they have bread, pasta, pizza, rice, oatmeal here, and they fall apart. Food allergy is extremely common. And many years ago when I first started, food allergy may not have been as big an issue, but every day I see this, and we test for this every day. You could have a delayed reaction to a food that you eat today, and you don't have a reaction for 4, 5, 6, 7 days because it takes time for your antibodies to build up to create that symptom. And in testing blood or skin's the most accurate for allergy. If we find that you have a food allergen, take those things out. We had a young girl in the office the other day, lovely girl, came in with a boyfriend, all sorts of problems, skin issues and bloating, indigestion. She never, ever thought about allergy. What 22-year-old kid, person, guy, girl, would think, oh, you know what, I better have allergy. They don't. Even adults don't think of it. So when we talk about it and let's see what the person's eating, and we come back with a test, and there are 10 things showing there, whether it's milk or corn, wheat is very common, gluten issues are very common. And I tell them, look, this is your big problem. It may be mostly this because nothing else is showing up. Let's get rid of the foods. Interesting, too, is when people have stomach problems, even at the consult before we do the testing or before we get the testing back a week later, I'll tell them, get rid of all the grains in your diet. No grains, 0. What about that? No, 0. What about? No grains. No bread, no rice, no oatmeal, no pasta, no corn, no grains. And as she came back to go over the blood work, she said, by the way, I feel like 30% better taking all the grains out. I'm like, see? So this happens all the time. So that's a very common issue. I'm not saying it's the only issue, but it's very common.
We got this one. It's a good one. Is oatmeal bad for you?
It's not a bad, horrible, will kill you food. Some people do well with oatmeal. But if your sugar's high, your cholesterol's high, your gut's affected, you have some issues, you may have issues reacting to grains, you could be allergic, then it's not going to be great for you. And I know lots of people who love oatmeal, and they're not allergic, and they're fine, and they do a lot of exercise, and they can do it. I just recommend organic, everything. So all the food should be organic because you don't want to keep putting in stuff to your body that, could easily have heavy metals. Look, arsenic is in chicken, shrimp, rice, apples, California wine, mercury in fish, fillings of your teeth. There are lots of different things that aluminum in pots and pans, aluminum foil. There's stuff everywhere. We did a whole show on water in plastic bottles, and when those bottles heat up, they leach metals into the water, besides the bisphenol A and all that. So, you want to eat as organically as humanly possible.
All right, this is a good one. I've noticed my skin bruises more easily. This is TikTok, by the way.
Okay. Finally, a TikToker.
Right? So I notice my skin bruises more easily than it used to. I don't remember hitting anything, but I find random bruises on my arms and legs. Is that just aging, or is it a sign of something else?
Well, some people that take aspirin or anti-inflammatories for aches and pains will make their blood a little bit thinner, so that's possible. Other individuals may have deficiency of nutrients that may correlate with that. It really depends. Is this a man or a woman?
Not sure.
Okay. It varies. Again, the big blood test will tell us a lot. You might have low platelets. There's some people that have low platelets, and that can be caused by some other weird things, including heavy metal exposure, because platelets are the things that help you clot your blood. So, you get a little bit of a bump and you have a bruise. Maybe your blood's not clotting as well as it should.
Okay, here we go. Instagram. I noticed a lot of, quote, gums in food today. Xanthan gums, etc. What are these ingredients?
These are either stabilizers or fillers. I'm not a big fan of having all sorts of other stuff in foods.
Hopefully it changes soon.
Yeah. I'm super excited, and I don't get this excited, but I'm super excited with RFK Jr. And whether you do or don't like him or believe him, this is going to be a terrific thing for everybody because, his platform is to get all this junk out of the food. I think he's amazing. If I can ever get a chance, and maybe I'll put the word out on every podcast. Anybody who knows RFK Jr., please tell him we'd love to talk to him. I'd love to have him on the podcast. Getting rid of the chemicals, the dyes, all this stuff in the food is an amazing thing. It's a wonderful thing. Food should be pure and without all the garbage in it. Other European countries, Italy, and many of them in France, have kept all the garbage and the fake meats and stuff from hitting the market. Here, unfortunately, money thrown at different people, politicians, allows bad stuff to come into our personal environment and in our foods and et cetera, et cetera, et cetera. Not to belabor that point, but get all the stuff out of the foods, have the best food you can have, grow your own food, get that garden thing in your house so you can grow your own perfectly controlled vegetables. Make a little garden outside, as I've done every year. And my dad, of course, rest his soul, made a garden for so many years, and we loved all the food from the garden. This is back when nobody knew what broccoli rabe and, arugula was. And, good Italian gardens had a lot of great stuff in it. Eggplant. I could eat eggplant every day.
We have a Maha chant in the live chat right now.
Yes.
Maha.
Absolutely.
We have an Instagrammer.
Thank you, Donna.
What do you think? What do you think cooking on iron pans for anemia? What do you think of?
Well, you're not going to get enough iron from a skillet to be able to fill your stores in your body. But iron skillets are safer, far better than aluminum pots and pans or some of those coated things. So typically I tell people to use iron skillets, Owens Corning, the ceramic, glass. You just want to be very careful what you're cooking your foods in. Don't use aluminum, foil, pots and pans, that sort of thing. But the best way, and people always ask, if I'm anemic, should I be eating liver? I'm not sure that you can really be sure as to what's gone on with that animal in his entire lifetime to know whether or not that liver is okay to eat or not. I'd rather you have a pure form of iron you can take in a vitamin. And gentle iron is really good. And that decreases the potential for constipation. But I would just take the capsule 1 or 2 or 3 a day, depending upon your levels. Sometimes we'll give people an iron shot into their glute so that you have a lot of iron sitting in the muscle. And as you move around, it brings the iron to your entire body. You can't really get iron from the skillet, or I wouldn't recommend eating liver.
All right. And then we have Kelly C. from Rumble. Can a person's skull grow after you are older, like 64? My forehead seems to be getting bigger. Wearing anything on my head causes migraines and leaves rings on my forehead.
Forehead's getting bigger. The only circumstance we see when people, in the older ages their forehead gets bigger because the hair is receding and they're not. You really can't grow taller or bigger once your bones are closed. I mean, there may be some odd circumstances where bones may increase in size, but that's typically can correlate with a bad disorder like a Paget's disease of the bone. So I probably would have it checked. Maybe a good X-ray would be important to do to look at the bones of the skull. I'd be curious if any other medical issues going on. But just the forehead seems to be larger and not the hand or foot or other bones.
We'll see if they respond. I wonder, is it just in the morning or is it, an all-day thing? Because there's inflammation in the morning, with just the face in general. But
yeah, it's hard to say. So as much as I love questions, and I do love them, I need more information to go on. And on the other
if
hand,
you'd like to call.
Yeah, sure. On the other hand, we have some people who email us on the website, and it's like a novel. I was like, wow, where do I start? I mean, I can't really answer. So we tell those people, obviously, to come in because we want to have that back and forth discussion. So the discussion is the key to being able to understand what's going on.
Yeah, we'll wait for the follow-up on that one. We have
RFK all day. I'm looking at our Rumble buddies here. Make America healthy. This is awesome.
Right?
I love the interaction here. Very cool. Yeah, kind of brand new for me, but I love it.
Okay, here we have another one, Instagram. Sometimes I get weird ringing in my ears that comes and goes. It's not loud, but it's noticeable, especially at night. Is that normal, or could it be a sign of hearing
It's
loss?
not unusual. A lot of people have that. And the weirdest circumstance, or one of the weird ones, is that sometimes little hairs, if you cut your hair, man or woman, will fall into your ear and just like hit up against your eardrum. So it's going to give you a transient weird ringing or sound or effect in your ear. So that may be one simple mechanism. Other people can have wax in their ear and could do a similar thing. People that also have ringing in the ear or tinnitus, whether if it's transient or if it's more consistent, may have issues with the positionings of their head, their skull, on the first two vertebrae of the neck, the atlas and the axis. So the strain that can occur there, because we're not steel beams that are unmovable, your skull doesn't always sit on the perfect position of the vertebrae the atlas and maybe the axis. So, and ligaments and tendons pulling back and forth, that could affect it. That's pretty common.
Okay, and we have on the live chat on Rumble, people are asking where you're located. Garden City, Long Island, New York.
Yeah,
but telehealth, all that, you want to give them that info?
Yes, of course. So the office is in Garden City at 1101 Stewart Avenue. It's on the second floor of the building where Orland & Cohen has the first floor on the outside. It's a weird-looking building, but it's pretty cool. We have it decorated nice. So, it's at the intersection between where Stewart Avenue and the Meadowbrook Parkway intersect. So if you're coming east or west, you just get off at Stewart Avenue. And if you're coming from east, you get off at Stewart Avenue west, and you can pull right into the parking lot behind. There are two buildings there. Ours is the second building. Been there for a long time now. It was in East Meadow office since 1988, and then we switched over to Garden City because it was a big, gorgeous building, and they allowed us to build it out. So I built it out the way that I needed it to look. And I'd rather make it look more like a living room or kind of like an art studio or places where you go, show art, because we have a lot of beautiful prints up on the wall, et cetera. So, in Garden City, 1101 Stewart Avenue, 516-794-0404.
So I see someone said, the cats and I live in Scottsdale. Well, luckily they do telehealth, over the phone, visits
of course.
and stuff.
So for people that are any distance away, or even for people who come in for the first visit and they want to go over their blood work, it's easier for them to do it from their home. So we do the visit over the phone. We do consults with people who come from anywhere. I've had patients come from all over the country. I've had people come from other countries. And even people listening to the radio. We had people listening from Europe, which always amazed me. But the telehealth visit, you would contact the office. We'll send you the link to get on and put your information into our computer. So we'll have all your demographics there. You fill out your history, your problems, some meds, this and that. So it makes it easier to do. And we just do it over the phone. Then we can either have a lab go to your place or send a prescription to you so the lab will be able to do your blood work at your local lab. And then when that comes back, then we do the second visit. So that makes it easier.
And we had a follow-up on that last one with the skull growth, we'll call it. They just added that any kind of pressure on the head gives me headaches.
So there's got to be some sort of neurological component. The reason why people get headaches is not a brain issue, because your brain really doesn't have the nerves to create the pain symptom. But a lot of people have neck issues, and if you were to see how the nerves that come out, that's a perfect example, that come out of between your vertebrae, they go up, and wrap around your skull. Some of that pain is coming from the issues in your neck and how your skull, which is this tiny little piece, articulates with your first, vertebrae, your atlas, and the second, your axis. And pressure on the nerve roots can give you that pain. Could you have swelling as a result of that too? Yeah.
Yeah. She said, or he said, like headbands, caps of all kinds. It's like my calves when you wear socks. It's even pressure from eyeglasses gives me migraines. I feel like I'm turning into a
migraine.
Neanderthal.
Huh. So migraine is very commonly correlated with food allergy. So it would be interesting to see if we found food allergy in you and we took those foods out, if this discomfort and the migraines went away. We've seen that in tons of people. So that's an interesting comment you make, an interesting correlation. So again, one or two parts of the picture, as you describe them to me, may not give me the whole picture, but the more you tell me, and that's typically what we do in either the consult over the phone or in the office, will give us a lot more information to go on.
Okay, and then we got Instagram again, blowing up. My 30-year-old daughter had a heavy metal blood test done, and her tin level came back extremely high. What would she be exposed to for that to be a high level?
So tin or aluminum, it's really the same thing. Underarm antiperspirant, pots and pans, aluminum foil. Metals are everywhere. If you're driving in an old car and you smell a tinny-like smell, you're breathing in something that likely could be metal that's grinding, and it could be tin. There are people that have weird jobs that will cut those aluminum studs you screw the sheetrock into, cutting those studs, that's aluminum exposure. So I'm not sure as to what the young lady has in terms of exposure, but a blood test is the tiniest peek at what's in your body. And here's the important comment. A blood test, when you put the needle in and you put one tube for chemistry, one tube for CBC, one tube for vitamins, one tube for metals, is only 3 seconds of blood. So it can't be what's stored inside your cells because they're inside your cells. It's only showing you what you recently were exposed to that's still free-floating, that was near the needle, that got sucked up into the tube. So this is how we have to think of the parameters of different types of tests. So if we see anything on a blood test for metals, we automatically do a urine test. The blood labs look at 5 things. The urine lab looks at 21 things. So it's much more, and it's a better reflection of what's stored in your body and maybe leaking out of storage. Big difference. Blood is a peak. Urine's a better picture. The third step we do is to take an IV that has calcium EDTA, a chelating agent, do a 20 to 30 minute IV, and then capture urine after the IV to see what we pulled out. So that IV, once it's done, you take home a container that's a gallon container of urine, and you capture urine for 24 hours. Bring it back to us. We send it to the lab and see what's really stored, because now we're pulling it out. Little peak, better look, pulling out. So that's the best way to determine what's stored in the system. Then, if you do that treatment 10 times, and this is all the science of this, at the 10th treatment, we repeat the urine. Now you have the first IV urine, the 10th IV urine, and you can compare and see what you've depleted, what's been pulled out. So that's the best way to evaluate what's there and how we're getting rid of it, because you want to prove you're getting rid of it.
Okay, Reddit. We're back. We're back. I feel like my memory isn't as sharp as it used to be. I forget little things like where I put my keys or what I was about to say. Is that just normal aging? I'm 55.
So that's a good question, and wording that question is important. Is that normal aging? So I typically say there's normal, there's expected, there's good and bad. It's not good. Is it normal? Lots of people have it. The older you get, the more you experience that. So if we were to look at this picture, the blood test, and correct your vitamins, and it goes away, great, we fixed it. And that happens in many cases. If we correct your hormones, and that between vitamins and hormones corrects it, yeah, those are very common underlying causes. Or for some people, if we do the NAD and you use little injections in your belly, with a tiny, like an insulin-sized needle, and all of a sudden that comes back, yeah, you're just fixing the things that are causing the problem. So there are lots of people who have memory issues and develop dementia and even Alzheimer's, but the meds for those things, and you could ask anybody, don't seem to work. But that's not what I talk about, meds. I talk about correcting the vitamins and minerals and hormones you need, and of course the peptides you need because you've always had them. I'd rather fix those things to make the function better naturally and organically.
We got a TikToker.
All righty.
I've been having trouble falling asleep even when I feel tired. I don't drink caffeine late in the day, but my mind just won't shut off at night. Any tips on fixing my sleep schedule?
So would love to know, man, woman, how old they are, because hormone decline will correlate with that. And for men, they need a little bit of progesterone, and taking a little bit of progesterone for men at night will help them sleep. So that we've seen. And again, my whole approach of anti-aging medicine kind of makes me specialize in hormones and have been for years, since the early 90s. For some people, men, it's thyroid. For some people, it's testosterone or DHEA, adrenal hormone. For some people, it's heavy metals, affecting your neurotransmitters, and that makes it hard to sleep. So it depends upon what we find as the cause. There are nutrients that are good for sleep. Some people like melatonin, some don't. Some people like to go buy a vitamin that has melatonin, theanine, valerian, chamomile, passiflora. You could do that. But for a lot of people that I see that try these things that don't work because they're not hitting the nail on the head.
53 female, by the way.
Yeah, so it's probably hormone decline because estrogen, progesterone decline will do that. But I'd like to see what the rest of the hormones are doing. So that would be important to look at the entire picture and fix what's wrong, because it can take, and people can spend a lot of time and effort trying different things and not get the result because they didn't hit the nail on the head. We hit the nail on the head with the blood test right off the bat. So
we have one from Reddit on intermittent fasting questions. I've heard that it can mess with your metabolism. What's your take? Does it actually work?
It's very curious, and I've seen lots of people who've done it. I don't come out of the gate saying you have to do intermittent fasting. But there has been research over many years where studies say that if you fast, there's a correlation with longevity. Good study. The people I see today are eating way too much carbohydrate, way too much junk food. That's the way it is. So if you cut back on your carbohydrate intake and you're doing a little bit of fasting, and you could have tea or coffee in the morning and maybe take some of your vitamins. I even tell people to have a protein shake, maybe some collagen peptides, if they want to fast until the late afternoon and then eat in a short amount of time, but they're getting good foods, good vitamins, etc. For some people that can work. I'm not saying you have to do that for your whole life, but if that can help you lose the weight that you have a hard time losing, short term, it's not a bad idea because you're decreasing the calorie presentation. You're getting rid of the sugar, exposure, which is great for your body because it helps to burn the bad things, helps to burn the fat. Sugar damages inside your cells, outside your cells, damages your nerves, your blood vessels. So it's bad all the way around. Sugar is probably the worst thing that, we've ever consumed over populations over a very long time. But it may not be a bad idea. I just don't want you doing a diet suggestion and be deficient on vitamins because then your body's going to suffer. So you want to have your nutrients on board. And there are varying degrees of the intermittent fasting. Some people will do it where they'll put a little protein scoop in their coffee in the morning, a little collagen peptide, great for your skin, your hair, your nails. You're getting good nutrients for your protein. Your body's invigorated. It's good for your immune response. Then they don't eat until 2, 3 o'clock, and they eat between 3 and 6, and they don't eat after that, and they do really well with it. And if your blood work's good for your vitamins, minerals, and hormones, then I'll stand by people doing that because we're proving they're in a good zone or a better zone.
All right. Any other questions? This is your chance.
888-420-9272, 888-420-9272. I'm looking over at our Rumble live chat.
We love Rumble.
Very cool. Very excited about Rumble.
Oh, yeah.
Lots and lots of people listening on Rumble. And, of course, we love our Reddit, TikTok, Instagrammers, YouTubers, all of them. And our LFA people, LFA TV.
Okay, we got our boy on Instagram. It's my favorite username. It's Sal Pickles.
Sally Pickles.
Sally Pickles.
Oh,
Hey.
What kind of pickles, Sally? Garlic?
So,
good name.
my daughter is 16 and has major anxiety. She wakes up and throws up almost every day. Her heart pounding and stomach upset. Any thoughts, ideas?
Yeah, we've got to figure out if the anxiety is correlated with low blood sugar, because if she's not eating, her blood sugar is going to be low. And people have low blood sugar, whether eating too much carb, too much insulin, dropping the sugar, anxious, irritable, panic attacks. Lots of things can occur with that. And if the nutrients are low and the foods are low, hormones are going to be affected. That's going to cause anxiety and panic. Someone could have inflammation in the lining of their stomach. So when things are presented, they get irritated and they try to throw the food out and they throw up. So we've seen it. We just have to figure out what the underlying, contributors are. The other thing that I hate to talk about, but you have to, is that some young people are vaping and doing things and putting a lot of crap in their body that's going to really distort their brain function, their neurotransmitters, their lungs, their body. Not that I'm saying or suggesting, but we have to ask and we have to look because it's there. You see a lot of it. So I want to figure out the entirety with that big blood test and then look at, what we can do to help to make us strong. And some people will do intramuscular B12 shots, D shots, vitamin IVs, and will help people get their strength and energy back. But we have to dig deep to figure out the underlying, causes.
So just an update, type 1 diabetic.
She's a type 1?
Yes.
Okay.
Yes, I believe they called in about the type 1 last week. That's what I'm remembering.
So, yeah, type 1, obviously, if the sugars are too high, the sugars are too low, you're going to get sick. So I'd rather be able to fine-tune and either use a food plan where you're snacking every couple of hours with little things and simple things that are not high sugar so your body can have a stabilized blood sugar. I don't know if she's taking or what meds she may be taking, insulin, injectables, or otherwise. You want to look at that as well to see if there's a correlation with, medication issues or side effects or dropping the sugar with medication. And for all of our type 1s, we've done stem cell therapy to put brand new cells into the bloodstream to go to the pancreas, and they will sit there, set up shop, and make more cells that can produce the insulin. So our type 1s typically have a significant decrease of medication requirement in that fashion.
Yeah, he said just insulin she's on.
Okay. Yeah, we'd love to help her out. Certainly give us a call to the website, and we'll, love to get the testing done and figure out what we can do for her. 220 people listening on Rumble.
I got 224 on my end.
Awesome.
226, it's going up.
Terrific. I love this.
This is your chance, guys. Got
Yep.
any questions for the doctor?
888-420-9272 if you'd like to call in. We are breaking all records, going beyond all boundaries. I never had 30-plus calls on my radio show in 35 years, and this is wonderful. So we'd love to chat with you. We'd love to help you out. 888-420-9272. Garden City office 516-794-0404. Website drcalapai.com. And, of course, we're here every Monday and every Friday, 12:30 roughly, sometimes depending upon traffic or my crazy office.
Yeah, if you're watching on Rumble, he also is live on, Monday and Friday. He's always live. Saturday, we have the ability to be on LFA, which is incredible. But if you would like to watch the shows throughout the week, they're at 12:30, Monday, Friday, on YouTube, Instagram, all Dr. Chris Calapai.
Yep.
So you could find us there.
Amazon, Pandora, all the other names of things that I've never heard of.
Amazon, the music, the podcast side of it. You can't order him on Amazon.
Not yet.
He won't come.
Not yet. You never know. One day. Yeah. 888-420-9272. If you'd like to call in to ask a question, you could do so now. A lot of great stuff today. Covered a lot of ground. We're going to be doing more interviews, have a bunch of people lined up, more topics, and as well the people who've called, rather emailed the website. We always take those emails and talk about their concerns. So whatever you're interested in listening to or hearing about, certainly give us a call, a text. We can handle lots of calls on the website, because we get them every day. Some people will hit the website right after the program or during the program, and the text messages go crazy, the emails go crazy. And same, for during the week, throughout the week. We have one of the gentlemen that emailed us yesterday. John's got low back pain, and he wanted to know what his options are. So low back pain, everybody gets it sooner or later because the ligaments of your low back are doing a huge job your whole life. If you've played sports and you've run around and do things and, you've had some wear and tear on your back, the ligaments are the first ones to get a little bit loose. You start to grind down on the disc, and then as that happens, muscles go into spasm. Then a later stage could be either disc bulging or herniation, and then arthritis, overgrowth on the bone, what they call osteophytes. So that's pretty much how that pans out. Depending upon where we catch that, if we catch it early, we could inject PRP into the muscle to strengthen muscle. We could do stem cells into your ligaments. Sacroiliac ligaments are very, very common. We can recommend traction at different facilities, physical therapy. And there are different things we can do to get those muscles stronger and more stable to hold position. It just depends upon where we are within that progression of the degeneration of those tissues. So combined therapy always works better than one thing. If you take a steroid shot, it'll be there to decrease the inflammatory mechanism, but it's not really creating repair or growth. That's what stem does. It's not really stretching out muscle spasm. That's what some physical therapy does. So I like using all the modalities to create the best outcome. Another email from Peter, and Peter asks about blood sugar fluctuations, and he realizes once he eats carbohydrate or sugary things, he feels foggy, lousy, and he just gets into he calls it like a food coma, and that happens for a period of time after he eats. And he can't go out and eat those things because if he's got to drive home and he's foggy or has his brain fog or food coma, your body may just be producing more insulin than you should in response to too much carb. So another common discussion I have with people is that if you've trained your body over years by eating lots of carb to produce extra insulin, now that higher release of insulin's knocking your sugar down, and you're going to be foggy and lose that sharp focus and ability. People who fast or people who don't have the carbs do well because burning fat is great for your body. It's great for your brain. Fat burning ketosis is great for your brain, even for neurologic disorders, which is one of the articles that I was going to go over. Maybe we'll do that on Monday. So keeping those grains out creates a much better fuel response for your brain and your organs. So it's probably to an advantage for you to have that problem when you're eating too much carb, because now you'll be able to stay away from the carb, and that's going to make your body healthier and make you safer. But, I talk about this every day. Restrict the carbs, get them down as low as you can in your diet, get organic vegetables and organic healthy proteins in, do the exercise, look at all your parameters for your vitamins, minerals, hormones. Let's talk about peptides, look at blood work for IGF-1, and you can get some great results fine-tuning your body. This is all about fine-tuning your body so you don't progress to get worse. Okay, one more call out, 888-420-9272. If you'd like to call in to ask a question or if you'd like to text us, we'll be here for a little bit longer.
All we got was that Sal Pickles said he'll drop off some pickles at the office.
Awesome. I love pickles. Who doesn't love pickles? Everybody loves pickles.
Loves.
Pickles are a good diet food because they taste good. They're crunchy. I remember many years ago, and I don't know if Sal, there used to be a place called Shoppers Village in West Hempstead. It's like one of these bizarre places where you go in and they'd have the pickle guy on the right and people selling this and that. And then again, Fairway, which I used to love. Fairway, Foods, a big supermarket, used to have all this big pickle section. I'd go in there and load up on pickles and the green tomatoes and stuff. I love that. I love the new pickles, which are like crunchy, delicious pickles. I love all types. So yeah, dropping off some pickles would be awesome. I don't know anybody who doesn't like pickles.
Okay, we have a final question. YouTube.
Okay.
Unexpected. Good afternoon, doctor. I'm a 58-year-old male with MTHFR C677T gene mutation detected. Feel good overall. What are some recommendations you could recommend or I should keep in mind? Any treatments for it?
The best thing for that defect, as we had mentioned at the beginning of the program, if you don't have the gene C677T to convert regular into methyl B12, is to take methyl B12 shots. Now, you could get the shots in our office once a week or whenever, but it's better for you to take those shots and do it to yourself with like an insulin-sized needle very tiny, and do it sub-Q, and you're getting the active, functional, ready-to-go form of B12. So you might take that shot and say, wow, I felt great for 3 days. Great, take it twice a week. So you'll feel good for the most of the week. The people who are doing tons of exercise might need to take it before they exercise. So there are different ways that we could make the recommendation, but people who try the sublingual B12 never come back to methyl B12, that is, and say, oh, wow, that sublingual made me feel great for 3 days. They just don't, they're not sure as to whether or not that's creating the result. But the shot where you get a real good amount of it, 1 cc of the methyl B12, people feel it. They feel it when we give them the shot in the office. But typically our patients, and we would test your vitamins, minerals, and everything else, because just having the defect for methyl B12 doesn't mean all your other vitamins and hormones are good. We would check that anyway. It's part of what we do. But you definitely should do the methyl B12 shots. You can feel great with that. Because you've never, ever, ever had great methyl B12 levels because you've never converted.
And then we just have a question. Is this show on LFA every Saturday? I found it by accident. And we can tell you, yes, it will be.
Absolutely, positively.
2:30 Saturday.
So, yes, we'll be here every Saturday, 2:30 onward. We haven't given a end of show time because
it changes.
We're rambling.
Yeah.
And when I first started, we were doing initially half hour, 45 minutes, an hour. Then we started taking calls. And now we're at an hour and a half, 93 minutes, 94 minutes and counting. So this is what I love to do most. And we'll be here for you every Monday and Friday, 12:30 onward. And Saturday, 2:30 onward. On many different platforms. And we love Rumble and we love LFA. So happy to be part of it. All righty. We're good. Thank you so much for listening. Breaking records here. God bless you all. Have an amazing weekend. We'll be back here Monday at 12:30, and we'll take your calls and chat about